My last task is really, I consider a privilege. I have the honor of introducing the next moderator, who is one of my colleagues. Dr. Akina Tamaki is an associate professor of otolaryngology, head and neck surgery, where she specializes both in the cancer extirpation or removal, as well as the important reconstructive surgeries to restore speech and swallowing. She functions out of both Temple and Fox Chase Cancer Center, and she's going to be leading the discussion on fueling resilience, optimizing nutrition for patients and survivors.
All right. Good afternoon, everyone. So I think this is a very appropriate panel because I know that this is the last session before lunch. So we are going to be talking about fueling resilience, optimizing nutrition for head and neck cancer patients and survivors in this session. So again, my name is Akina Tamaki. I am one of the new head and neck cancer providers at Temple Health and Fox Chase Cancer Center. So briefly, this session focuses on specialized nutritional needs and swallowing difficulties experienced by those receiving treatment of head and neck cancer. Our panel is diverse and consists of a speech pathologist, we have an oncology nutritionist, we have a registered dietitian, and also a cancer survivor. Our goal is to enhance your nutritional outcomes, help improve swallowing outcomes, and elevate your overall quality of life during head and neck cancer treatment, as well as for those survivors. We will be taking questions at the end, and feel free to, for those who are joining virtually, to also post online. Now, let me begin by introducing our panelists. So our first is Ms. Linda Goldsmith, who is one of the outpatient oncology dietitians at MD Anderson Cancer Center at Cooper. We have Liane McCarroll, who is one of our senior speech pathologists, who is an assistant research professor, also at Fox Chase Cancer Center. Shelby Burns is joining from also Fox Chase Cancer Center, and she is one of the oncology nutritional care coordinators. And then lastly, I'd like to special welcome to Ms. Nicole Laswell, who is our cancer survivor today. I will let her talk about her story, but briefly as an introduction. So Ms. Laswell was diagnosed on July 2022 with tongue cancer. She underwent a hemiglossectomy, and she also underwent a neck dissection. Her surgery went very well and was very successful, but she did have a significant depth in terms of her cancer and led to a pretty challenging recovery. During her recovery, Nicole committed herself to extensive speech therapy, occupational and physical therapy to regain her strength, mobility, and function. And now, 2 years after, she finally feels recovered from all of her care. So I'd like to start with Ms. Laswell to share her story.
Is this on? Can everybody hear me? This is like very overwhelming, and the first time I presented in this fashion. So there we go. Can you hear me now? Yes. Okay. So this is the first time I've presented in something this big. My name is Nicole Laswell. I am from Bucks County, Pennsylvania, from Doylestown, and I am a wife, I'm a mom, I'm a stepmom. I was married in the middle of COVID, the second marriage, 2020. And by nature, I am an occupational therapist. That's my job. I work in a school district in New Jersey. I've been doing that for over 25 years. I love my job. I love my kids. Working in the school is a little different than it used to be. But all in all, I mean, I'm just had a great life, and my journey, what brought me to be in front of all of you, thank you, is in 2013, I noticed a little white patch under my tongue. Thought, this is weird, can't brush it off. My dentist said, you know what, you better go get that checked out. So I did. I followed up. I had a biopsy. It was determined to be precancerous. And my doctor was not concerned. I didn't have any of the risk factors. I was young, I'm 52 now, so that was over 10 years ago, so I was 42. And I was just followed up for a couple of years. Nothing changed, everything stayed the same. So fast forward to summer of 2022, I noticed a little red patch. My tongue was very sore, felt kind of like a muscular ache. Spicy food was bothering it. And when I looked, I had an ulcer right in the same spot where my leukoplakia was. So I went to have a biopsy, kind of had a bad sinking feeling that something was wrong. And I was right. So in July 2022, I was diagnosed with tongue cancer. I had my surgery September 27, 2022. I had a partial neck dissection where they removed 31 lymph nodes. Happy to say there was no cancer in my lymph nodes. I was clear. But I also had a hemiglossectomy where they took a good amount of my tongue. As Dr. Tamaki said, my cancer was not very big where the tumor was, but it was very deep. So I had a challenging recovery. I'm not going to get into all of that stuff because it was a lot. I was in and out of the hospital a couple of times. I'm going the wrong way, aren't I? There we go. That's my family. This is some of what I went through when my first surgery. There's my dog healing with me. And this was when I had a feeding tube, which was on and off several times. As I said, I went through a very challenging recovery in and out of the hospital several times for excessive bleeding. Fortunately, I did not have to have chemotherapy, but I did have to have 30 rounds of radiation because of the depth of my tumor. So there's me at the end of my radiation, ringing the bell with my husband there to support me, who's been by my side every step of the way. When I was going through treatment, I really focused on, especially, this is my speech therapist, Liane, sitting next to me. Fortunately, I get to be on the panel with her, but I really focused on everything that they told me to do. I was like, give me all the information, I'm gonna soak it all in. So I really focused on the exercises that Liane gave me for swallowing, range of motion, my tongue mobility, started that as soon as I was able to after my surgery, which I really feel like helped with my recovery, my ability to eat, speak, and do everything that I needed to do to feel my best and to get back to my life. So I'm going to talk a little bit about what I use for nutrition. Post-surgery, that gets a little bit different after radiation, but post-surgery, I really focused on getting my protein intake in. I used a variety of things. I have my best friend was my magic bullet, my NutriBullet. If you have one of those, it's the best thing in the world. You can blend up anything. It might not always be what you want to eat, but you can use it for everything. And I did a lot of protein shakes with frozen kale, frozen spinach, fresh fruit. When I wasn't able to do that, I used Fairlife protein. I think that's better than some of the nutritional drinks that you can get, in my opinion. A lot of vegetable soups that were blended. I had an enormous amount of support and people giving me food, and that was one of the things that I appreciated the most, was having people bringing me soups. And because it was in the fall, that was a great time for me to have that. A lot of scrambled eggs, again, getting in that protein. I put the picture up there of the mashed potatoes and the turkey because Thanksgiving is one of my favorite holidays for a lot of reasons, but it's also because of the food. And with this type of cancer, it's really hard because that is a very social part of it. So that was my goal, was to be able to eat Thanksgiving dinner with my family and not have to have a shake. So that's not my exact plate, but that is something very similar to what I had. So that was about 2 months after my surgery, was Thanksgiving. Moving on, during radiation, as we've talked about, we've heard so many of the side effects that I'm sure a lot of you have experienced. For me, dry mouth was the worst side effect. I carry this water bottle with me all the time. Let me take a sip now. As I'm sure a lot of you can attest to, every time I leave the house, I have a gallon of water that I use. I drink at least a gallon of water at work. And I focused a lot, continuing on the protein. I used a lot of different gravies to get things down, because when you lose that saliva in your mouth, it's really hard to move everything around. Macaroni and cheese, again, protein pancakes, anything. And when you're going through radiation, food doesn't really taste good. So just trying to get it in any way that you can. I also put something called Helios was a supplement that I took. I see a few people shaking their heads. I think that that really helped keep my mouth healthy and keep everything kind of moist and cleaned out. And that was something I believe that was developed by a doctor at MD Anderson. This is something I wanted to put because these are things I never thought I'd be able to eat again. You know, popcorners, super simple, but it's one of my favorite things in the world. I can eat those now. I can have Mexican food. I still can't do a lot of spice, but that's one of my favorite things to eat is Mexican pretzels, nuts. I can enjoy steak again. That's something that I never thought, and I'm only 2 years out. So little bites. We just talked about the dental. Having a water pick has literally saved my life with so many things because everything gets stuck in there and you don't realize how much you need your tongue for removing things in your mouth and getting things down. So the water pick has been really good for me. I do brush my teeth multiple times a day, and I use that water pick every night or when I feel that there's something in there that I need to get out. So that's my story. This is my family. I'm enjoying time with my friends. Again, I'm pretty much back to 95%. I still have some things that bother me, but this has made me a stronger person. I never knew the strength that I had until you go through something like this. But this is I'm sorry. This is so important to have this community and to reach out to others who have been through it because nobody knows what you're going through except the survivors that are in this room. So thank you for the opportunity to be here and share my story.
Ms. Laswell, that was wonderful. Thank you so much for sharing. I know that that's wonderful to see for all the survivors out there and incredibly humbling to all the physicians and teams that are lucky enough to take care of you guys. So our next speaker is going to be Linda Goldsmith. All right, take it away.
I was told I have 6 to 8 minutes and I have to talk slowly, so this is a lot of pressure. Where's the little J? Here we go. So these are some organizations that make very specific recommendations on, what as a cancer survivor or someone who wants to prevent cancer, you should do. And you can certainly look all these things up online. I do like the first one, the American Institute for Cancer Research, because they offer a lot of information and a lot of recipes, which is always fun to try and switch things up. I find that a lot of my patients are always looking for something different and something new. So these can be helpful organizations, especially the first one. And I did leave some recipes out at our table and some ideas for smoothies. So Michael Pollan is absolutely one of my favorite authors. He wrote 2 books, The Omnivore's Dilemma and In Defense of Food. And he sums everything up to 7 words, which is eat food, not too much, and mostly plants. So eat food, that's a little obvious, right? But basically what he means is eat food that looks like a food, not something that necessarily is highly processed. We're going to go over that a little bit more. Not too much is the association of having a lower weight and less risk of cancer, and mostly plants is about plant-based foods. We're going to define all of these. So definitions. I feel like this slide is pretty much self-explanatory. Whole foods are foods that look like food, and processed foods come in bright colors. So processed foods are pretty much the things you see here. They have chemicals in them. They have a lot of syllables in the ingredients. Certainly a grapefruit is a grapefruit or a bean is a bean, but you kind of have to read the ingredient lists because there are some processed foods that are actually kind of okay. When you read the ingredients, you see food, but sometimes you see chemicals, and those are the kind of things you want to watch out for. Plant-based foods, anything that comes from fruits, vegetables, whole grains, legumes, nuts, coffee and tea, yes, thank you, are plant-based foods. So these are the things that you want to make up the bulk of your diet. The American Institute for Cancer Research has several recommendations. There's actually 10 across the board. I'm going to briefly touch on 5 of them, the ones that relate to food. And the first we already talked about, eat a diet rich in whole grains, vegetables, fruits, and beans. From that, you're going to get fiber, micronutrients, phytonutrients, and things that you absolutely want in your diet. The hot button in nutrition is the microbiome. So plant-based foods have lots of things that are good for your microbiome. You want to limit your consumption of fast foods and other processed foods that are high in fat, sugars, and starches. Now, fast food is evolved over the years. When I was a kid, there was McDonald's and Burger King. Now we do have some other fast food choices, like I think that Chipotle and Panera and Cava all have some good choices for people who prefer to eat healthy and they don't necessarily want all the processed foods. So I feel like fast food at this point in time has definitely become a better option, but you still have to watch out. You can still make bad choices. Limit red and processed meats. This is just a recommendation across the board. You're supposed to limit red meat to about a pound a week, which, again, it says limit and not eliminate. I'm not saying that you need to be vegan. There are places in the world for lean protein sources. But if your breakfast choices are sausage and bacon every single day, you might want to reconsider that, just because there are some correlations between some cancers, not head and neck cancer, but some cancers and processed meats. Limit consumption of sugar-sweetened drinks. Now, this one is one that patients who are going through treatment, who are in slow recovery, sometimes my patients will tell me that Sprite is the only thing that cleans their mouth out. Every patient's different. That might not work for some patients, but there are places in the world for some of these foods, especially when you're a survivor, and there's only certain things that work for you. And then alcohol consumption is something everyone should limit. I know the American Heart Association made a recommendation that you should drink red wine, but the negative attributes of alcohol consumption are definitely outweighing that recommendation, and I do believe that they're going to rescind it. You heard it here, folks. So recommendations are great, but how do I manage my nutrition impact symptoms? So here's some stuff for the survivors, and this is actually, I think, only 2 slides. The first one, Nicole already talked about, smoothies and soups, and they're my 2 favorite things for survivors. The NutriBullet she spoke about is amazing. There's a lot of great blenders out there. You want to look into what kind you're going to buy, maybe talk to some other survivors and see what's working for them. Smoothies are amazing because you can put lots of protein in them. You can use a base of milk or plant-based milks. You can also use oral nutritional supplements. If you're using something like Fairlife, it's great to throw those into your base of your smoothies. You can add protein powder. You can add nut butters, Greek yogurt, or cheeses like cottage or regatta. You can add fats if you need calories. Nut butters, avocados, whole dairy will all add fat. Fruits and vegetables, with smoothies, I feel like the sky is the limit. You can use frozen or fresh fruits. I used to throw baby spinach into my son's berry smoothies because he didn't like vegetables when he was a kid, and he had no idea that they were in those smoothies. So it's kind of also a good way to mask the taste that maybe you don't love. And then you can add fiber to your smoothies, which can be really great to normalize any bowel function issues you are having, especially if you're taking some type of a pain reliever. Soups and stews, it's fall, so it's a great time to talk about these. Again, a blender can be a godsend here because you can pretty much throw any soup into a blender and make it into something that might have a consistency you can tolerate if you can't tolerate any of the chunks. You can use milk or plant-based milk, bone broth, homemade stocks, lean meats, lentils, beans, and dried peas. All these things are going to add protein, and as we discussed, protein is very important. Vegetables, you can do tons of things with vegetables. And then there's also cold fruit or vegetable-based soups like gazpacho, and the American Institute for Cancer Research has some fruit soups on their website. So, and that's it.
All right, so my name is Liane McCarroll, and I'm going to talk about the role of the speech pathologist. All right, so historically, the goal of head and neck cancer treatment has been to cure the disease. However, with increased survivorship, the impacts of these treatments are being focused on more thoroughly, and treatment outcomes are impacted by the quality of the care our patients receive from the support services. So you can have an amazing operation, you can have the best radiation there is, but receiving high quality care from your speech pathologist, your dietitians, your physical therapists are going to give you better long-term outcomes. And the goal of the speech pathologist, when we're talking about swallowing, is to focus on swallowing safety and efficiency while looking at quality of life. So dysphagia, which is difficulty swallowing, can be caused by issues involving the mouth, the throat, the esophagus, or a combination of these areas. Dysphagia can lead to potential consequences such as malnutrition or dehydration. These are things my nutrition colleagues are touching on. Can also lead to aspiration pneumonia and that reduced quality of life. So briefly, aspiration pneumonia is a type of lung infection that can be caused by food, liquids, saliva, or bacteria going down the wrong pipe, right? I think all of us have had that sensation, right? You take a sip of something maybe too quickly and you cough and people say, oh, it went down the wrong pipe. It is important to remember, though, that not everyone who aspirates will develop an aspiration pneumonia, and there are certain things that can increase the risk of developing a pneumonia, such as having poor oral hygiene, being dependent on others for feeding, tube feeding, and having a weak immune system. But there are things that you can do to reduce your risk of developing an aspiration pneumonia. Oral care, I think we've talked about that a lot this morning, and there's just so many benefits to keeping our mouths clean. Some other things are sitting upright during and after a meal, staying physically active, and considering the diet modifications or safe swallowing techniques that may be recommended to you by your speech pathologist. So whether or not you choose to follow all of our recommendations may depend on how you feel those recommendations impact the quality of your life. Quality of life is a very broad term, and it's a complex interplay between your expectations, your perceptions of your functioning or ability, and then your overall satisfaction or happiness. So having dysphagia does not impact everybody's quality of life in the same way, but we know that dysphagia after head and neck cancer treatment is associated with reduced quality of life. In fact, dysphagia is the leading cause of reduced quality of life after treatment, and it is reported in over 70% of survivors of advanced head and neck cancer. If you have dysphagia, you may avoid eating in front of others by isolating yourself during meal times, or avoid social activities that revolve around food. Additionally, some patients opt to not follow diet recommendations, and that can lead to stress or strain within the family unit. Because it's one thing for someone in the family to say, oh, your speech therapist, recommended when you drink liquids that you do a left head turn chin tuck, but it's another thing to have to do that every single time you take a sip. So how do we address dysphagia? So it's by working with the speech pathologist early and often. You can look at the care of dysphagia kind of across the continuum of care in 3 different time points. So first we have preventative, which would be before or early in treatment. Restorative, so in the first few years of treatment concluding, and then chronic or late. So the treatment that we provide years after you've finished your cancer treatment. So the primary focus of our care is going to vary at these different time points, but first we're going to do an assessment. Based on that assessment, we can make diet recommendations, recommend those safe swallowing strategies, in addition to teaching exercises and providing education and counseling on those results. Okay, so we can't treat what we can't see. So Instrumental assessments, and Ian touched on these earlier, are key. So the one study here that's playing right now is a modified barium swallow study where we are watching you eat and drink under x-ray, and then the other one that just started playing is a FEES where we are watching you swallow with that scope that goes in the nose and in the throat. And Ian, I have heard as well that the speech pathologists are better at scoping than our physician colleagues. Now, maybe the patients are saying that to the physicians as well, and they're trying to get on our good sides, but it's uncomfortable either way, but these are, great tests to show us how things are working, and they guide us in providing treatment. So when we look at care before treatment or in the early phases of treatment, it's preventative. At that time point, we are establishing a baseline. So we're identifying any impairments that might be there as a result of the cancer itself. And we're promoting exercises early aimed at reducing future impairments. So we can also, at this point, begin talking about potential function post-treatment, as we know that baseline function is highly predictive of post-treatment function. Restorative or rehabilitation is, I think, what most people think of when they think of therapy, right? Like, I have an injury and now I'm having therapy to get it better. So this, our goal here is to provide therapy to give you the best swallowing function. And this is when our therapy is going to be the most effective, kind of right after treatment's ended within that first year or so. Additionally, completing the work at this time point can help you to decrease the risk of having long-term swallowing issues. So some diet modifications, softer solids, swallowing techniques I mentioned, right? Turning your head to the left, tucking your chin. Those are some techniques we might recommend based on what your swallowing test shows us. And then we'll also teach exercises or reinforce prior exercises. I believe at the resource table, there is a handout to talk about the head and neck cancer virtual coach, and that is an app that you can download on your phone that has different videos of how to do some different swallowing exercises, but I thought we could all try one now. So what I want everyone to do is you're going to stick your tongue out just a little bit, not too far. You're going to make it too hard for yourself. You're going to hold it between your teeth gently, and now swallow without letting your tongue go back into your mouth. All right? Now, if you stick your tongue out a little bit further, you're going to make that harder for yourself. So that's one swallowing exercise. The Masako, sometimes we'll call it the tongue hold swallow, is an exercise that I'd say is fairly common that we give to our clients. So as you progress into survivorship, the role of the speech pathologist often shifts from working to improve function to focusing on education and counseling and supporting swallowing and goals around eating and drinking that are in line with your quality of life. Annual assessments within a survivorship clinic help to monitor for potential late effects of treatment as they progress, so we can provide care as early as we identify issues. And our goal is to really reduce complications associated with dysphagia. So in conclusion, early and frequent involvement of the speech pathologist has been demonstrated to improve quality of life, as our cancer treatments have improved priorities such as swallowing function long-term is changing what it means to have successful cancer treatment. Thank you.
Which button do I press? Is it not that? Also use the keyboard. Perfect. Thank you. Yeah. Okay. Thank you for dealing with my technological difficulties up here. So today I'm going to be talking about ongoing eating concerns after the acute phase of treatment. So kind of touching on a few of the really big nutrition impact symptoms that a lot of head and neck cancer survivors tend to have, depending on which ones you have, how severe they are. It can really be an indicator for decreased nutrition outcomes as you go through the acute phase of treatment and beyond. So some of the really most common nutrition impact symptoms that we're going to be talking about today are xerostomia, so dry mouth. I know we touched on this quite a bit today, and any sort of salivary issues, as well as dysgeusia, which is taste changes, and trismus, which is that restricted opening of the mouth, also coupled with this dysphagia. So how to manage these symptoms? Number one, talking about the xerostomia, that dry mouth, that you feel like your mouth feels like a desert. The biggest thing that I have heard over and over again today is good oral hygiene. So making sure that you're keeping that mouth really clean, brushing your teeth. I would recommend using a baby toothbrush or a soft toothbrush and just really working it around, getting the insides of your cheeks, the roof of your mouth, all over your tongue. Again, just to make sure that your oral health is top-notch, that you're really making sure that's clean. Some other good suggestions are sugar-free lemon or peppermint lozenges or gum, again, just to pull that saliva out and try to make your mouth feel as moist as possible, helping with that dryness feeling. You can also turn to a commercial mouthwash, lozenge, tablet, something like Biotine or Xylamelts, to again try to pull that saliva out and help with the feeling of that dry mouth. If you don't want to go purchase something, you can try making one at home using salt water and baking soda. So you can see up here the little recipe that we use and give to patients to try to, again, just like you would a normal mouthwash, take a sip, swish it around, and spit it out. Particularly helpful right before you're going to eat a meal to try to make that mouth feel a little bit less dry. In addition, going for foods that are moist already, but if the foods that you're eating are not, adding gravies, adding sauces, butter, oil, things like that that can make the food a little bit softer for you, a little bit easier to get down, a little bit easier to swallow. And then also alternating bites of your foods with liquids. So after you take a bite, take a sip of whatever liquid you're using to, again, help wash that food down, make it feel a little bit less dry. Taste changes. These can be really, really difficult, and everybody has a different experience, what sort of foods they can tolerate, what sort of foods they enjoy. So this one can be really, really individual. Again, emphasizing good oral hygiene, making sure that you're brushing your teeth, rinsing your mouth either with one of those commercial rinses or one of the homemade saltwater and baking soda mixtures, but also avoiding alcohol-based mouthwashes. Those can actually make those taste changes worse. So, trying to avoid those and go for one of the other alternatives would be better. Using foods that, cooking with different marinades, different sauces, using a variety of spices. So everybody's going to be a little bit different with what sort of foods they enjoy and what sort of spices and tastes they enjoy. So just trying to make sure that you're finding what works best for you. And this is going to be a lot of trial and error. So, it's not always going to be perfect, but hopefully you do find something that tastes good and works well for you. In addition to that, not only changing the flavor, but changing the temperature of foods. So trying cooler foods versus warm or hot foods, that can help with some of those taste changes. Those warm and hot foods tend to have a lot more smell to them, so that scent might be stronger and might be altering your taste a little bit. Changing the type of utensils that you're using. So if you have that metallic taste, trying to avoid metal utensils and go for bamboo or go for plastic utensils to help alleviate that metallic taste in your mouth. And also placing liquids with strong odors in a cup, with a lid, with a straw, just trying to really avoid those strong odors the best that you can. Now, again, depending on what sort of taste changes you're having is going to depend on the adjustments that you're making. So often I hear people have just an off taste. It's just not right. They can't exactly pinpoint what it is, but it's just not the same. So in that case, really trying to go for different herbs, different spices, lemon, vinegar, pickled foods, things like that can really help. So again, we can find what works best for you. if you are having that metallic, that bitter, that acidic taste, going for, again, changing the utensils, but also going for, more sweet and sour beverages, things like lemonade, juices, sweet tea, can really be helpful in terms of getting taste that, that are good to you. Again, the tastes are going to be very individual, so it might take a little bit of trial and error, but I always like to know, I know spicy food comes up a lot, but actually the spiciness is more of a heat sensation, so adding spice to your foods might not necessarily help with those taste changes. Some people also say that they have an enhanced saltiness or enhanced sweet taste, throughout their treatment and beyond. So if you have that really, really salty taste, trying to avoid foods that do have a lot of additional salt, so a lot of our processed foods can have that, going for more whole foods, trying to boil our foods to decrease that salty taste, going for foods that are naturally sweeter, so things like fruit. And then if you have that really that really sweet taste, trying to choose foods that are not naturally sweet, choosing vegetables over your fruits, trying to go for more sour, more bland foods, trying to dilute our juices. So then that way, you don't have that sweet taste as much. And lastly, how to manage the trismus. So that's, again, that opening, restricted opening of the mouth. And here's where, we really work very closely with our speech-language pathologist to help make sure that the consistencies of the food that you're eating are safe, are the best consistencies for you. And then as the dietitian, we can kind of come in and also make additional suggestions on what other foods can work within that consistency. So as you see up here, there's a lot of softer foods. I know these have been mentioned a lot today, just, a couple ideas to really go for that softer diet, trying to avoid those really hard and crunchy foods. If you can't open your mouth all the way, try to do things that are a little bit easier for you. And just to wrap it up, I always like to mention the long-term effects nutritionally. So if these nutrition impact symptoms are not dealt with, they're not managed well, it can cause you to eat less, it can cause you to lose weight, it might even lead to malnutrition. Obviously something that we really, really want to avoid. Making sure that your quality of life is good is super important, whatever that means to you. And also recognizing the mental challenges that come with this. So, the chronic nutrition impact symptom burden that head and neck cancer survivors go through, it can be life-changing, it can be, negatively altering. So recognizing that, if you have to eat different, that might make you feel self-conscious. It might make you not want to go out to eat. But to me, I always say food is love. It can be very social, it's emotional. We eat when sometimes we're happy, sometimes we're sad. So recognizing that now you have to eat in a different way that's going to be safe and effective for you. Us as healthcare providers, we really have to recognize that and help you manage those challenges as you're going through them. So not only the physical burden, but also the mental burden is, dealt with, and that you can live the best quality of life, whatever that means to you. Thank you.
Great. That was wonderful. Thank you to all the panelists. So I already have a couple of questions, but feel free for anybody in the audience who also has a question to raise their hand. And I think there are some people with mics in the audience as well. So here's one question. So what resources are there for various recipes and smoothies and soups that are not cold, do not use ice, but are warm, but also healthy? Any books and websites that you guys can recommend?
I think I mentioned the American Institute for Cancer Research, and there's a lot of great books. I kind of use what works for me. Like, I'll start with the base, and so if you want to look up like a basic smoothie recipe, you can wait for things to come to room temperature if you don't like the cool or the warm. And there are actually blenders out there who will also create soups in that they cook them. Like, you don't have to put it on a stove. There's blenders that will bring soup too. And they have a lot of recipes on their website, like a Vitamix type of product. I'm sure Ninja probably has a website that has lots of ideas. I feel like Google is just a beautiful thing, and you can find anything you're really looking for. So, but again, look for those whole foods whenever you can. I know that sometimes we have to use some oral nutritional supplements that might look a little bit more processed, and that's fine to do if that's what you need to do at the time. So.
I had a comment about swallowing. Thank God, a friend of my sister's who's a dentist who specializes in treating head, neck radiation got hold of me and said, don't lose your ability to swallow. You know, we heard earlier that it's easier to maintain function than to regain function. And I had been in touch with a cancer team who immediately put in a peg tube when somebody begins treatment, and I didn't want to do that. And I finally had support from this dentist who said, you need to continue swallowing what you can swallow. Mashed potatoes, eggs, whatever it is. Don't lose that ability. So, and just in case people didn't know that, keep swallowing food to the extent you can, not just liquids. That's all. Thank you.
So another question was, what type of blood work is needed to determine malnutrition? What do I request? I might be also able to answer this one as well. So we often order albumin, prealbumin, and then we also trend people's weights during their treatment, before their treatment. A very common question we should always ask is how much weight have you lost during the duration of your symptoms, et cetera. And then also your provider should be checking a TSH also on the regular as well. Another question here. So this might be a Liane type question. So there's an audience member asking about cost. Sometimes there are limits on how many SLPs as well as a number of appointments that patients can get. How do I maximize this?
So that is a great question. Certainly different insurance companies have different rules in terms of, you know, how many visits you can have with a speech pathologist. There are not timed sessions. So like if you're in for a swallowing therapy session, you know, if it's a 30-minute session versus a 60-minute session, it's still one visit. And I think really optimizing your time with the therapist so that you're building on each session and really focusing on that home program. You know, if you're only doing work with your therapist once a week in the office and you're not following through with the exercises at home, you're not really going to really get max benefit from that. There are times where things do get denied based on coding, and your therapist can do peer-to-peer reviews. You know, if you have a chronic issue because of your cancer treatment, there are, you know, I think advocating for yourself, and, you know, I've done peer-to-peer reviews with insurance companies, so, you know, if your therapist is not doing those things or offering those things, ask them, or maybe you have to find a different provider.
Thank you. So another question, how do you navigate the feelings of isolation in social gatherings often involving food when eating is uncomfortable and sometimes embarrassing?
So that, can everybody hear me okay? So it can be really difficult, right? So sort of how I mentioned, you know, the way that you eat is different. It doesn't feel the same if you have to follow a soft diet. There was one study that indicated up to about 42% of long-term head and neck cancer survivors actually had some sort of altered consistency diet. So whether that was a soft diet, whether that was pureed, a tube feed. So finding what makes you most comfortable. So I know it was mentioned earlier, maybe you pick out the restaurant. You look ahead to see that there is something there that you can eat, that you're comfortable eating. If you are going to a social gathering, either, you know, at someone else's home, a friend, a family member, you know, maybe you offer to bring something that you know that you can eat, that you're comfortable eating. Again, it really depends. It's very individual with how you feel and, you know, what works best for you, but just trying to find ways that you feel comfortable, put yourself up for success. So set yourself up to, to be in that comfortable space and to eat the foods that you are comfortable with. And that's going to look different for everybody.
Yeah, I want to comment on that too, because I know I was going through this during, Thanksgiving, Christmas, and really looking at if you're going to go out somewhere, looking at the menu beforehand. If you're going to go to a party, put your water in a wine glass, like just so you can kind of be part of what's going on. You're not going to be drinking. I don't really drink much at all anymore. I never really did. But, finding something that's going to kind of make you, so you don't have someone saying, hey, why aren't you drinking? Well, here, I'm having my juice in a wine glass. And then putting things on your plate, and having things and just kind of picking at things, but really preparing yourself ahead of time, I think is a really good idea. And I would eat things before I went out, just in case there wasn't something, because it is it can be isolating with that social piece for the eating. Those are some things I did.
I have a question about the spicy food and help to swallow and have a good perception of food. I know that spicy food is painful after radiation therapy for head and neck cancer. Is it really painful and irritating to the tongue and the mouth, or it is acceptable, and how it is in real life?
So again, everybody's going to be a little bit individualized with this, but the spicy foods, like I mentioned, so that's more of a heat sensation. So, that can cause pain in some patients, and it can cause some uncomfortable swallowing. So if that doesn't work for you, I do know a lot of patients who just, avoid the spicy or go for a little bit more mild, and that can work. But again, it's all, on an individual basis, what you can tolerate best and what's most comfortable for you.
I think a recurring theme here that I'm hearing everyone saying, you've mentioned it several times, is individual. Everybody is so different in what they can and cannot tolerate that you just have to keep experimenting with flavors, textures, and spices, because it's really hard for me to make a blanketed recommendation for how your experience is going to be versus how another patient's experience might be.
Okay. I think we have maybe time for one or two more questions. So one from the virtual audience. What are the long-term consequences of weight loss for head and neck cancer survivors?
So weight loss long-term, it depends on how much you're losing, over what amount of time, what your body weight is, if you're at a healthy weight, if you've lost too much where, you're really underweight and would benefit from gaining some more back. Some people are naturally a lower weight. Some people are naturally a little bit higher. So, kind of like we've mentioned, again, everything's going to be a little bit individualized, but just trying to make sure that your body is well nourished. So making sure that you're getting enough of your micronutrients, your macronutrients, your protein, your carbohydrates, your fats, trying to have that good balance in your diet. Weight is one of the tools that we use, but it's not everything. So, working with your dietitians and your medical teams to just make sure that, we're sort of making a point to not only look at weight, but how you're doing in other areas, how you're eating, how your lab work looks. So there's a lot more that we look at that can be helpful to, to really key in on how you're doing overall.
And just to build a little bit on what Shelby said, is it's also about your functionality. I always talk to my patients about what's your energy level like, because I don't always want to be focusing on that number, because I feel like some patients get very discouraged. So are you able to move around and do the things you want to do and try and build on that? And this is where the physical therapists come in, because they can actually help people regain function after treatment and weight loss.
Great.
So, hi everyone, I'm May St. John. I'm a head and neck cancer surgeon from Los Angeles, and I sit on the board of the Head and Neck Cancer Alliance. First, I just want to thank everyone, thank you, Nicole, and all the patients in this room for sharing, because it energizes us, it inspires us, and it keeps us back to why we went into this field in the first place, to help people like you. And your stories just really are just mean so much to us. When my children ask, why are you flying to Philadelphia for the day? This is the reason, because it means so much, and I want to thank you very much from our perspective. I also just want to share just one thing I haven't heard, maybe it's a Los Angeles thing, but a lot of our patients really like using coconut oil. One of our patients started it at one of our survivorship meetings, and a lot of our patients say they put it in their mouth before they go out to a restaurant, and it helps things kind of slide through. They use it as like chapstick for the oral cavity, and I've heard it over and over again. I'll also tell you that one of my patients says that he likes Cheese Whiz. None of my other patients like it, but he uses Cheese Whiz, and he says it works very well. So I just wanted to share with you and thank everyone in the room. Thank you so much.